I'm not lying to you. This is smallpox.
So there are many forms and degrees of severity of smallpox.
All the reasons you thought it wasn't smallpox still exist.
Forget her feet, forget all those other reasons. Look at him now.
Good nursing care is essential to prevent secondary bacterial infection of the skin lesion.
Eschars appear with rickettsial pox, but not with smallpox.
If he had developed eschars, I would have noticed.
In the same sample, 87% had less than 100 pox on the face.
The disease, now eradicated, was once one of the world's most terrifying. Smallpox ranks among the most devastating illnesses ever suffered by humankind. Today, we will look into the horrifying history of smallpox. The history and spread. Smallpox is a viral disease that has been known to humanity for thousands of years, and it has played a significant role in human history. The disease is caused by the variola virus and is highly contagious, with a mortality rate of up to 30% among unvaccinated individuals. Smallpox spreads through direct contact with an infected person or through inhalation of droplets expelled by an infected person. Smallpox was first described in ancient times, and it is believed to have originated in Africa or Asia. The disease spread to Europe and the Middle East through trade routes, and it reached the Americas during the European colonization period. The first recorded smallpox outbreak in the Americas occurred in the 16th century, and it devastated the indigenous populations who had no immunity to the disease. Smallpox outbreaks were common in Europe during the 17th and 18th centuries, and it was a significant cause of mortality. In the 18th century, the British physician Edward Jenner developed the first effective smallpox vaccine, which involved using cowpox virus to provide immunity to smallpox. Despite the vaccine's effectiveness, smallpox continued to claim countless lives worldwide. In the 20th century, smallpox was responsible for taking the life of an estimated 300 to 500 million people. Smallpox outbreaks occurred regularly in many parts of the world, and it was especially devastating in regions where populations had no immunity to the disease. In some outbreaks, mortality rates were as high as 90%. One of the most horrifying aspects of smallpox is the way it spreads. The virus is highly contagious and can survive on surfaces and in the air for extended periods. Infected individuals can spread the virus even before symptoms appear, making it challenging to control outbreaks. The disease also has a high rate of transmission, with each infected person capable of infecting up to 5 others. The impact of smallpox on human history is profound. It played a significant role in the colonization of the Americas, and it decimated indigenous populations. It also played a significant role in warfare, as armies used infected blankets and clothing to spread the disease to their enemies. Smallpox was also responsible for numerous epidemics, including the Russian flu epidemic of 1889 to 90.
In the same sample, 87% had less than 100 pox on the face. Good nursing care is essential to prevent secondary bacterial infection of the skin lesion. So there are many forms and degrees of severity of smallpox.
Early control efforts. Smallpox was a terrible disease. On average, 3 out of every 10 people who got it slayed. People who survived usually had scars, which were sometimes severe. One of the first methods for controlling smallpox was variolation, a process named after the virus that causes smallpox. During variolation, people who had never had smallpox were exposed to material from smallpox sores by scratching the material into their arm or inhaling it through the nose. After variolation, people usually developed the symptoms associated with smallpox, such as fever and a rash. However, fewer people died from variolation than if they had acquired smallpox naturally. The basis for vaccination began in 1796, when the English doctor Edward Jenner noticed that milkmaids who had gotten cowpox were protected from smallpox. Jenner also knew about variolation and guessed that exposure to cowpox could be used to protect against smallpox. To test his theory, Dr. Jenner took material from a cowpox sore on milkmaid Sarah Nelm's hand and inoculated it into the arm of James Phipps, the 9-year-old son of Jenner's gardener. Months later, Jenner exposed Phipps several times to variola virus, but Phipps never developed smallpox. More experiments followed, and in 1801, Jenner published his treatise on the origin of the vaccine inoculation. In this work, he summarized his discoveries and expressed hope that the annihilation of the smallpox, the most dreadful scourge of the human species, must be the final result of this practice. vaccination became widely accepted and gradually replaced the practice of variolation. At some point in the 1800s, the virus used to make the smallpox vaccine changed from cowpox to vaccinia virus.
We don't know that it's definitely smallpox, not until we get the DNA results back from the CDC.
Intense frontal headache and backache are usually present. Vomiting may occur.
Eschars appear with rickettsial pox, but not with smallpox.
If he had developed eschars, I would have noticed.
Is still less severe and is fatal in only 10 to 15% of cases.
I'm not lying to you. This is smallpox.
Horrifying experiments conducted, as this disease plagued humanity for thousands of years. Throughout history, there have been many attempts to understand the disease and develop effective treatments and vaccines. Unfortunately, some of these attempts involved horrifying experiments conducted on human subjects. Edward Jenner conducted one of the most infamous smallpox experiments in the late 18th century. He believed that exposure to cowpox could provide immunity to smallpox. To test his theory, he deliberately infected a young boy with cowpox and exposed him to smallpox. The boy did not contract smallpox, but Jenner's experiment was a violation of medical ethics. Another horrific smallpox experiment was conducted by the Japanese during World War II. The Japanese Army's Unit 731 conducted extensive biological warfare research, including experiments on human subjects. In one experiment, prisoners were infected with smallpox and then treated with various experimental drugs and treatments to determine their effectiveness. Many of the prisoners demised or suffered severe health consequences as a result of these experiments. In the U.S., a smallpox vaccine trial was conducted in the early 1960s that involved deliberately infecting mentally disabled children with the virus. The children were housed in a state-run institution and were not given informed consent for the experiment. Many of the children suffered severe health consequences, and some died as a result of the experiment. In the 1970s, a smallpox outbreak occurred in Yugoslavia, and the government conducted a mass vaccination campaign. As part of the campaign, military conscripts were deliberately infected with the virus to determine their immunity levels. The experiment was highly controversial and violated ethical principles of informed consent and non-maleficence. These experiments, and many others like them, are horrifying examples of the abuse of human subjects in the pursuit of medical knowledge. They represent a dark chapter in the history of medicine and serve as a reminder of the importance of ethical principles in medical research.
When smallpox appears as a classical textbook disease, it's easily diagnosed.
All the reasons you thought it wasn't smallpox still exist.
Forget her feet. Forget all those other reasons. Look at him now.
The purpose of this film is to show clinical manifestations of variola major, its various degrees of severity.
You don't know that I have smallpox yet.
The film demonstrates the differential clinical and laboratory diagnosis of smallpox and chickenpox.
Global Smallpox Eradication Program. In 1959, the World Health Organization started a plan to get rid the world of smallpox. Unfortunately, this global eradication campaign suffered from a lack of funds, personnel, and commitment from countries, and a shortage of vaccine donations. Despite their best efforts, smallpox was still widespread in 1966, causing regular outbreaks across South America, Africa, and Asia. The intensified eradication program began in 1967 with the promise of renewed efforts. Laboratories in many countries where smallpox occurred regularly were able to produce more, higher-quality freeze-dried vaccine. Other factors that played an important role in the success of the intensified efforts included the development of the bifurcated needle, the establishment of a case surveillance system, and mass vaccination campaigns. By the time the intensified eradication program began in 1967, smallpox was already eliminated in North America 1952 and Europe 1953. Cases were still occurring in South America, Asia, and Africa. Smallpox was never widespread in Australia. The program made steady progress toward ridding the world of this disease, and by 1971, smallpox was eradicated from South America, followed by Asia 1975, and finally Africa 1977. Last cases of smallpox. In late 1975, 3-year-old Rahima Banu from Bangladesh was the last person in the world to have naturally acquired variola major. She was also the last person in Asia to have active smallpox. She was isolated at home with house guards posted 24 hours a day until she was no longer infectious, A house-to-house vaccination campaign within a 1.5-mile radius of her home began immediately. A member of the Smallpox Eradication Program team visited every house, public meeting area, school, and healer within 5 miles to ensure the illness did not spread. They also offered a reward to anyone who reported a smallpox case. Ali Mao Malan was the last person to have naturally acquired smallpox caused by variola minor. Malan was a hospital cook in Merka, Somalia. On October 12, 1977, he rode with 2 smallpox patients in a vehicle from the hospital to the local smallpox office. On October 22, he developed a fever. At first, healthcare workers diagnosed him with malaria and then chickenpox. The smallpox eradication staff then correctly diagnosed him with smallpox on October 30. Malan was isolated and made a full recovery. Malan demised of malaria on July 22, 2013, while working in the polio eradication campaign. Janet Parker was the last person to be demised of smallpox. In 1978, Parker was a medical photographer at England's Birmingham University Medical School. She worked 1 floor above the medical microbiology department, where staff and students conducted smallpox research. She became ill on August 11 and developed a rash on August 15, but was not diagnosed with smallpox until 9 days later. She was neutralized on September 11, 1978. Her mother, who was providing care for her, developed smallpox on September 7, despite having been vaccinated 2 weeks earlier. An investigation suggested that Janet Parker had been infected either via an airborne route through the medical school building's duct system or by direct contact while visiting the microbiology corridor. World free of smallpox. Almost 2 centuries after Jenner hoped the vaccination could annihilate smallpox, the 33rd World Health Assembly declared the world free of this disease on May 8, 1980. Many people consider smallpox eradication to be the biggest achievement in international public health, and rightly so. That's all for this video, folks. See you next time.